presenting a brief presentation on insomnia for the village's health. Keep in mind this presentation is designed for educational purposes only and is not intended as a substitute for advice from your own healthcare professional. We will look at what is insomnia and its causes, followed by treatments that may be able to help, looking at both prescription and non-prescription items. Insomnia is a common sleep disorder that can make it hard to fall asleep, hard to stay asleep, or cause you to wake up too early and not be able to get back to sleep. Sleep is essential to every part of the body, affecting our physical and mental functioning the next day, our ability to fight disease and develop immunity, as well as our basic metabolism and chronic disease risk. Before I go any further, I wanted to define a couple of scientific terms and processes that I'll be referencing throughout this presentation. First, a neurotransmitter is a chemical messenger that carries a message via a chemical signal from one nerve cell to its target area to produce a result. Two of the main neurotransmitters involved in sleep are serotonin and melatonin. Serotonin helps to slow down your thinking, and melatonin regulates your body's clock, letting you know it's time for sleep. This diagram shows the order of the steps in which all of the ingredients are put together to produce each of these neurotransmitters. Tryptophan is first converted to something called 5-hydroxytryptophan, which is then converted to serotonin, which is then converted to N-acetylserotonin, and finally to melatonin. In a later slide, I will reference this conversation to explain why taking certain supplements may lead to better sleep. There are many different causes of insomnia. Stress can keep your mind racing, unable to shut off. Changes in travel or work schedules may disrupt your regular sleep routine. Not having regular sleep patterns or routines in terms of waking and going to bed can also contribute to difficulty sleeping. When we eat a heavy meal late at night, muscles involved in digestion keep working instead of resting. Some mental health disorders, such as schizophrenia or obsessive compulsive disorder, can also keep the brain active at night, making it difficult to sleep. Some medications, such as antidepressants, decongestants, and steroids, can also lead to insomnia. Conditions linked with insomnia include chronic pain, Parkinson's, and Alzheimer's disease. Caffeine and nicotine can also have a stimulating effect on the body. Insomnia becomes more common with age. Sleep often becomes less restful as you age, so noise or other changes in your environment are more likely to wake you. With age, your internal clock advances, so you get tired earlier in the evening and wake up earlier in the morning. But often, people still need the same amount of sleep as they used to when they were younger. Estrogen plays a role in the metabolism of serotonin and melatonin, which are the neurotransmitters that affect your sleep-wake cycle by moving magnesium into tissues. Since magnesium is necessary to work with tryptophan to convert to those additional items, creating serotonin and melatonin, as estrogen levels decline, the amount of magnesium absorbed into the brain can decline, which may explain why we have lower levels of serotonin and melatonin in the brain, making it harder to sleep. Researchers have also found that as testosterone levels drop, the amount of cortisol circulating in the body increases. Cortisol is the body's primary stress hormone. One of its functions is to increase alertness, which can result in shorter sleep cycles and shallower sleep. You may be also less socially and physically active as you age, and a lack of activity can interfere with a good night's sleep. Also, the less active you are, the more likely you may be to take a nap during the day, which of course would interfere with sleep at night. Chronic pain conditions more likely to be associated with older people arise, such as arthritis or back problems, or depression or anxiety. Issues that increase the need to urinate during the night, such as urinary or prostate problems, can also interfere with sleep. Sleep apnea and restless leg syndrome become more common with age. Older people typically use more prescription drugs than younger people do, which also increases the chances of insomnia. Many of the causes of insomnia are temporary or situational and can be addressed by addressing some of those items listed on the previous slide, such as changes to travel or work schedules, consuming heavy meals, caffeine, nicotine, or alcohol late in the day, or taking medications with side effects, or many others. Next, we will take a look at what constitutes a good sleep practice or sleep hygiene, or how to set yourself up for the best position to sleep during the night. Follow a regular sleep schedule and avoid napping. This can be easier said than done because it requires that you won't go to bed until the time you choose, even if you're tired, and you will get up at the scheduled time, even if you're tired. Be careful about what, when, and how much you eat and drink. If your body is working to digest food, it's not able to get to a restful state that it would otherwise. Developing a relaxing bedtime routine is helpful. A bedtime routine is a set of activities you will perform in the same order every night in the 30 to 60 minutes leading up to going to bed. Like any other routine, bedtime routines establish habits that help your brain recognize when it's time to sleep. Following a regular bedtime routine can help shift your mind away from troubling thoughts and focus on other tasks and encourage yourself to relax and reduce anxiety. Some suggestions include reading a book, listening to soothing music, or taking a warm bath or shower. Once you get in bed, give yourself 15 to 20 minutes to fall asleep. If you are still awake, get out of bed. And then when you feel sleepy, go back to bed so that your brain associates the bedroom only with sleep. Keep the bedroom dark, not too hot or too cold, ideally between 68 to 72 degrees, and as quiet as possible. A cold sleeping environment helps lower your body temperature, making it easier to experience deep sleep. Also, lower temperatures help with melatonin production and better sleep quality. The body requires a quiet and peaceful environment to fall asleep and avoid any disturbances that might wake you up in the middle of the night. Experts believe that unexpected noises and sounds tend to wake up the body as you transition through the various stages of sleep. So if you need the noise of a television to help you fall asleep, make sure that you put it on a timer so that it doesn't wake you up during the middle of the night. Have a comfortable mattress, pillow, and enough blankets. You may have to invest in different pillows and a mattress if your physical health has changed and you now experience a chronic pain. An alternative to a different mattress would be a mattress pad. Exercise at a regular time each day. This helps minimize sleep disruptions by inducing deeper and more restful sleep phases. Exercise can also prepare your body for a quicker onset and more rejuvenating sleep. If none of those items help you after a 2-week period of time that you've really made a consistent effort to adhere to them, another alternative to explore may be cognitive behavioral therapy for insomnia. You would meet with a therapist to learn how to change your thoughts and behaviors that may be keeping you awake at night using a combination of the techniques below. Cognitive restructuring. This is an instance in which you would work with your therapist to identify and change unhelpful thoughts and feelings like anxiety and unrealistic expectations. Stimulus control helps you create a consistent, stimulus-free environment in which the only activity you do is sleep, getting up and leaving the environment whenever you're not able to sleep. Sleep restriction involves recording the minutes of your actual sleep time, then allowing yourself to stay in bed only for that time plus an additional 30 minutes, resulting in yourself getting more and more tired until you can gradually increase the time spent in bed. Relaxation training, such as deep breathing or listening to a meditation app, can also help. Other treatments include light therapy. The idea is that sunlight helps control your body's sleep and wake cycle by regulating the sleep hormone melatonin. When that cycle is thrown off, artificial light that mimics sunlight can help in a practice called light therapy. You sit in front of a special box that puts out an intense light at a specific time of day and for the length of time your doctor prescribes. Research has found that it's particularly helpful with resetting your body clock if you work odd hours, like a night shift or have jet lag. But it can also help relieve insomnia. However, research also shows that if you have a condition such as bipolar disorder, it's not recommended because it can trigger some type of episode. Acupuncture. A large number of studies have looked at whether acupuncture may be an effective treatment for insomnia. 2 reviews of research published in 2021 have found that it does in fact, help people keep asleep and wake less often. Supplements. As I mentioned earlier, magnesium is essential for the creation of serotonin and melatonin. In addition to improving your overall quality of sleep, magnesium can also improve restless leg syndrome, a condition that causes insomnia and may affect up to 10% of the population. Some dietary supplements may help jumpstart the production and release of serotonin by increasing tryptophan. Think back to the diagram on the previous slide I showed you at the beginning of the program. So the idea is that if you're able to take some of the subsequent ingredients used to make melatonin and serotonin in your brain, it may then therefore allow you to have deeper sleep. And those ingredients or different elements are listed below. S-adenosyl methionine, and then that 5-hydroxytryptophan and tryptophan. It's also noted that getting more probiotics in your diet may increase tryptophan absorption into your blood, helping it, again, more of it reach your brain. Before taking any of these supplements, again, a reminder, I cannot stress enough, make sure that you check with your healthcare professional to make sure that they will not interfere with any of the current prescription drugs that you're taking. Next, I'm going to take a high-level general look at some of the different classifications or types of sleep medication. Again, keeping in mind that I am not a doctor. Benzodiazepines work by enhancing the effects of a neurotransmitter called GABA in the brain. There is a signal pathway in our brain that is responsible for levels of consciousness and anxiousness. When this neurotransmitter called GABA interacts with its receptors in the brain, it inhibits or slows the activity of this pathway, increasing sedation and decreasing anxiety. Non-benzodiazepines are a relatively newer class of drug. Although they work by influencing the same GABA neurotransmitter, they are structurally different and tend to be associated with less side effects. Some antidepressant drugs are very good at treating sleeplessness by reducing anxiety and increasing serotonin levels. Some of the latest sleep medications are called orexin inhibitors. They work a different way by blocking the action of a different brain chemical that keeps you alert, called orexin. Most over-the-counter sleep aids are antihistamines, which induce drowsiness. Since your body makes melatonin as the sun goes down, telling you it's time to sleep, a prescription form of melatonin may also be very helpful. Your healthcare provider will ask you questions to gain an understanding of your sleep patterns to determine whether you have problems getting to sleep or staying to sleep, when you usually wake up, when you usually go to sleep, and how tired you are during the day. Any underlying conditions that may be causing insomnia or medication side effects, such as anxiety, may also be keeping you awake. They will also work with you to figure out how much time you usually sleep. All of these factors will go into determining what type of prescription drug might be best for you. Overall, it's best to remember that all sleeping pills have side effects and risks associated with them, and they should only be used short time due to the potential development of tolerance, addiction, abnormal sleep behaviors, or grogginess during the next day. The preferable approach is to instead focus on identifying the root causes of insomnia and then seek professional help if the problem persists. If you're looking for more information on any of the topics that I've included in today's presentation, here's a list of some possible resources for you. Thank you so much, and I hope you've enjoyed the presentation.